So basically, as John said, what I would like to take you through is just some of the key findings from our report here today. And really what that report is a 7-year journey in self-management that the organisation has gone on. And I think the findings will be very interesting to many of you in the audience, whether you're a health professional, whether you're somebody living with arthritis or another chronic condition, whether you're somebody working in the health service executive, or maybe you're working for another chronic disease organisation, or even for our industry partners out there as well. So I think there's messages in there for everybody. And I suppose just what I want to do is just set the scene. So our experience is in relation to programs, a specific structured self-management education program in relation to arthritis. However, arthritis is a group of, if you like, chronic conditions. So just to set the scene around self-management and how we propose that it does actually help us in meeting the rising tide of chronic conditions. Probably the information that's on the slide here isn't news to anyone in the room. 1 in 3 people in our population has one or more chronic conditions. In fact, 38% of the population. So there's quite a lot of people out there in Ireland and indeed the developed world who are experiencing and living with chronic conditions on a daily basis. And this has obviously a huge personal cost to the individuals who are living with those conditions, but also to our healthcare system. And actually 3/4 of all the costs that arise in our healthcare system can be put down to chronic conditions. And when we look more specifically then at things like GP costs, 80% of the total bill for GP costs arises from chronic conditions, and 60% of hospital bed days. So I think that just helps build up a picture of the big, I suppose, challenge that faces us is in our health system. We hear about it obviously in the media all the time, but that challenge is also likely to grow as chronic conditions grow. And why are they going to grow? Well, our population is ageing. Better treatments, better health technologies, better prevention has meant that people are living longer now than they ever have before. Our society is actually probably living longer and is healthier than it ever has been in the past. However, that will also mean that chronic conditions will rise in the future as well. But there is hope there, and a stat that I found very sort of interesting was the fact that 75% of people who are living with chronic conditions can actually be supported to manage their conditions. And when you look at chronic conditions, and for those of you in the audience who are living with chronic conditions, you'll know that very little, only a small percentage of your care actually happens in a clinical setting. The rest of the time, it's really up to you and perhaps the help of your carers or family members. So whether you like it or not, you are actually self-managing. And really what you have is a choice whether to be an active self-manager or a passive self-manager. And those of you that have done the course or indeed are leaders will have heard that term a lot. So the choice is really whether to become an active self-manager. So that's the person who takes on some of the skills and actually actively changes aspects of their lives, develops tools and skills to live the best quality of life that they possibly can. Or whether you become a passive self-manager. So that's somebody who really, I suppose, lets their condition engulf them and sees that there maybe is nothing that they can actually do to change the situation that they find themselves in. What we're here to say today is that self-management is a really vital part of the prescription. So it's a vital tool in complementing the medical treatment that a person might already be receiving for their chronic condition. And I suppose what this picture really defines is that the effects of living with a chronic condition are very broad and very, very wide. So when we think of arthritis, the number one thing that people mostly think about is the physical symptoms. So whether it's the pain, the disability, the lack of function, or the loss of function, they're the number one things that people often think about, and that can go for a lot of other disease areas as well. However, the effects are actually much broader in range than that. They affect a person's social life, so they affect the social activities and the social roles that they may have been taking part in before they were diagnosed. It obviously affects a person economically, not only from the point of view of the cost of the treatments that they may be on, but also maybe in terms of their working life. Maybe they have to reduce their working hours, maybe they have to seek a different form of employment. Also affects a person's cognitive ability as well, their psychological ability. And I think this is one of the things I've always heard the most from people while I've been delivering courses. It's probably the thing that people are most unsuspecting of. The emotional distress that a chronic condition like arthritis can place on an individual. The fear, the frustration, the anger at the diagnosis, all of those difficult emotions, and of course depression as well. And depression often goes hand in hand with many chronic conditions as well. And then it affects a person's cultural life. So, you know, do you become more isolated, more withdrawn from activities that you once enjoyed, experiences that you once had, maybe the ability to travel abroad, to visit other countries. All of these are effects that a chronic condition can have on a person's life. And I suppose what self-management does is it helps people to develop the skills and the tools to live a better quality of life. And there's lots of terms, I suppose, there's lots of definitions of self-management, but what I often say to people is it's simply what you do as an individual on a day-to-day basis to manage your disease or your condition or your set of conditions that you might have. So it's what a person actually does on a day-to-day basis to help themselves manage. So in Arthritis Ireland, as John said, we have really been transforming people's experiences of living with arthritis for a long number of years. And back in 2006, we introduced the Arthritis Self-Management Programme really in a response to what people were telling us. You know, it was in response to what we were hearing on the ground in terms of the complexities of living with a disease like arthritis, and the difficulties, the lack of understanding, and just the whole need for people to develop skills themselves to manage that condition on a daily basis. So we actually, back in 2006, we had actually had a limited experience with the Arthritis Self-Management Programme back in the mid-90s, and I suppose I kept hearing about that, and we kept hearing about it in Arthritis Ireland, and we investigated it more, and we felt that all of the evidence that had been done internationally on this programme stacked up to a really good proposal and proposition for people living with arthritis. So we set about delivering our first programmes in 2006, and since then, as John has outlined, we've delivered the programme to over 3,500 people in 200 courses through 80 trained leaders, and when Claire and I both trained as master trainers, that's enabled us to train more people and increase our infrastructure on a yearly basis since that time. And it means really that we've had courses running from Carndonna, County Donegal, to Belmullet, County Mayo, to the city centre here in Dublin, to Killarney and Tralee and Kerry, and indeed into West Cork. So we've actually brought the programme right into the heart of communities in Ireland, and I think that's one of the things that is really stands to the programme. So what is it? Well, basically what it is a 6-week programme, and I'd like to quote Kate Lorig here, who I picked up one of her quotes, and she basically said that it isn't, you know, support group or group therapy. What it is really is a structured education programme with a very, very strong evidence base behind it, that's been there for over 30 years and developed over that time period as well. So there's very strong evidence that it actually does work, and obviously that appealed to us. So since that time, we've been actually you know, changing the way helping people change the way they view themselves and the role that they play in managing their arthritis. And I suppose what we did was we wanted to actually, we looked at all of the international evidence, but we also wanted to look at it in an Irish context. What difference, you know, is this programme making to people in Ireland living with arthritis? So we undertook a 3-year evaluation, and we were supported in that by the University of Ottawa as part of the OMERACT project. So they were very interested in researching a new startup self-management programme. So they actually, pro bono, they actually analysed all of the data. So we did all the data collection across the courses for 3 years. And what we did is that we surveyed people before they ever started the course. We surveyed them at the end of the 6 weeks. We followed them up at 6 months, and we followed them up at 12 months. And that gave us a really, really good picture as to how the course actually helped people. And these are sort of the key findings. So the number one thing that people with arthritis will probably tell you about is that pain is probably the number one thing that interferes with their life. And this programme unequivocally improved their ability to cope with pain, because central to the programme is educating people about tools that they can use to manage pain on a daily basis. And it's really up to individuals to come up with their, if you like, their toolbox or their toolkit to manage their pain. Different things work for different people, and that's what people learn on the programme. Then they become more active in managing their arthritis, and this is a central part of the programme. not only do people become more active, but they become more confident, and that's a real principle underlying the programme. If we can actually affect people's confidence in their beliefs to manage their condition and to take a more active role in managing their condition, then they are more likely to be successful, and it can have a significant effect on their outcomes and their clinical outcomes. Exercise is often heralded as the magic bullet or the magic pill for arthritis, but there's a lot of misinformation out there and a lot of change of beliefs that was needed. Lots of people with arthritis would believe that exercise will actually damage their joints or cause more damage or cause more pain, and in fact the opposite is true. Exercise is sort of like that the number one thing that you can actually do to help yourself. So the course actually helps people. Over the course of the 6-week programme that we run, it helps people to increase their exercise and to problem solve around their exercise and to get them more active. People also improve their attitude towards living with their condition, and this can often be helped by the fact that the course takes place in a group setting. So they're surrounded by people who themselves are living with some of the same problems and difficulties that they themselves face. So it does help people improve their attitude. I suppose a lot of books and that have been written about positive thinking, but positive thinking does actually help people when they're living with a chronic condition, and we know that people who are more positive have better outcomes. So the course does focus on that as well, and we're glad to say that our evaluation held that up, that people who improve their attitude can actually have better outcomes. People also increase their knowledge of their condition. So whilst the programme is not necessarily a disease education programme about arthritis, it gives people the tools to go off and information seek around their particular type of arthritis or the particular condition that they have. So they get more motivated, they become more confident to engage with the information that they might need about their disease. And also we found that the programme reduced the visits to hospital and a reliance on GPs as well. So this is again held up internationally in the evidence because people become more confident. So things that they may have once gone to their GP about, they feel a little bit more confident now to actually solve that problem themselves. It's not to say that they don't obviously liaise and partner with their healthcare professionals, but there are things where a person with increased confidence can actually deal with that better. So when we look at just some of the stats around our research, as I said, we conducted this research with the University of Ottawa, and we used a number of evaluation scales that are all approved by Stanford University, and indeed they're the same scales that Stanford would have used for all of the programs that they've researched from the late 70s. And there'll be, so we measured sort of the self-rating of health. So we asked people to rate their health, and people had increased their self-rating of health. Fatigue is a symptom that many people with arthritis experience, and it's often the one that I hear people talk about the most in terms of people talk about the pain, but it's the fatigue that people often have the real difficulty with, because it can really interfere with everything that's going on in their lives. So the programme definitely does help people with their fatigue levels, and we measured that. We also found that it decreased decrease in disability around household and everyday tasks. So just the everyday tasks that a person needs to do as a function of daily living. There was a decrease in disability around those tasks. So again, there's a scale to measure that. And also a decrease in arthritis interfering with social activities. Because obviously the idea with a programme like this, and I suppose a goal of a lot of people, is to maintain the life that they once had in as far as possible. So, seeing a decrease in arthritis interfering with social activities is an important measure of that. Also a decrease in health distress. So health distress is again, I suppose it accounts for a set of symptoms, and it can be things around depression, low mood, anger, fear, frustration, and again the programme really works hard on those kind of concepts, and we're glad to say that we saw a decrease in that. And also I suppose that the last two stats there are very powerful. As I said, the programme does actually encourage and motivate people to improve their exercise behaviours and increase their frequency of exercise, and we found that was borne out in the evaluation as well. And also in terms of GP visits as well, they were reduced by a quarter. So there's very strong evidence that this programme actually does work. And over a course of 6 weeks, people are exposed to lots of different topics that are all really grounded in helping them to develop skills and tools to better manage their arthritis and ultimately to live a better quality of life. I'm not going to talk too much about this because I know Professor Larriga is going to talk about it in a minute, but just to say that the evidence that we have just presented is largely borne out by the international evidence that has been undertaken over a long number of years. So I know back in '91, Kate Larriga and her colleagues in Stanford conducted a 12-year study into the programme, and that produced very positive findings. And there's been another number of other studies over the years as well. In 1998, Julie Barlow in the UK evaluated a large number of programmes that were happening there as well, again with very positive outcomes. And the CDC, the Centers for Disease Control in the US, have also done further research more recently on the programmes, and indeed on the chronic disease self-management programme, which I know some of you here today are involved in that programme, and that's more of a generic disease management programme for people living with a range of chronic conditions. So currently, really what there is that there's a growing acknowledgement that this intervention as a standalone intervention does actually work. And it does produce positive benefits for people living with arthritis and other conditions. And just if I was to take one aspect of our so the international evidence, this was a report that Kate Larriga conducted, and it looks at sort of the savings. So it's just really a litmus test to show you the kind of savings that you can expect to see from a programme. So if you look at patients with rheumatoid arthritis, the savings were $648 versus $189 for people with osteoarthritis. So this is looking at the savings from people who actually undertook the programme. And also it looked at sort of the pain would decrease by 20% and GP visits up to 40% as well. So they are very positive findings, very positive results. And that's why I suppose we are here today to say, well, this programme absolutely works for people with arthritis and we'd like more of it. And we've invited you here today as well to see how we can best forge ahead with delivering more of this model and supporting more people to self-manage in the community. So we have a number of key recommendations. And the first one really is that self-management should be a core clinical priority, and at the moment we don't believe it is. But the evidence that I've just presented is very strong evidence that it does work for people with arthritis and other conditions. So it should be a core clinical priority. But in order for that to happen, we certainly need more referrals coming from the health system, and that's certainly not been our experience so far. So we need more clinicians, more healthcare professionals referring patients to the programme because we know it makes a difference. And certainly some of the research I've come across more recently would strongly suggest that it is people sometimes with the low confidence and who have, I suppose, poor sort of health behaviours where the greatest change can actually be made. So there's an even greater role for healthcare professionals to refer people to programmes like this. Secondly, obviously, if we are to make it a core clinical priority, we need additional funding to roll out more of these programmes. And really it is quite a low-cost intervention delivered in the community by people living with arthritis in the main, although there are some health professionals, certainly in Arthritis Ireland, delivering the programme as well. But it's a fairly low-cost intervention. But obviously funding is needed to continue to build that infrastructure. And our second recommendation really is around education and training for clinicians and health professionals in the area of self-management. Because if patients are out in the community and they're receiving education around self-management and they're putting this into practice in their daily lives, they really need to be met in the system by people who understand self-management. And it does really require quite a shift in the model, the old model, where the clinician sort of patient model. So we feel that that's really, really important, and there is a growing body of evidence now that recognises the key role that healthcare professionals play in providing self-management support in a clinical setting as well. And then our last one, I suppose there's a really vital role here for the voluntary and community sector, and I suppose Arthritis Ireland have led the way in the delivery of self-management programs in this country for the last 7 years. But I also know that there are many organisations here today who are delivering various self-management activities, and indeed perhaps self-management programs as well. And I suppose we are ideally placed to provide this service to people living with arthritis. We're actually in touch with people living with the various diseases in our membership, in our communities. And I suppose we would feel that there's a real partnership approach here to take with the statutory sector to recognise that we actually play a vital role, and we have huge expertise in this area, which we're only waiting to expand and offer to more people living with other chronic conditions. Okay, thank you very much.